Again, my name is Dr. Brenda. I'm working here with Estetique, and we are very excited to present to you today the webinar, which is called Beyond Ozempic Fat Reduction Alternatives with the LipoMax. So what we're going to do today is we're going to give you different alternatives of other ways that we can help our clients get better results with LipoMax, and how can we do more things in between or before our practice to get better results to our clients. So first of all, I want to introduce LipoMax for the ones that don't know our technologies yet. So LipoMax is one of the latest aesthetics devices that provides remarkable results in face and body treatments. We can do contouring, tightening, lifting, rejuvenation, and much more things with the same machine. So we're going to use 3 different technologies with our machine. The first one will be radio frequency. We have photopneumatic massage, which is a vacuum therapy, and we're going to have also LED light therapy. And whether you're working with either dieting or medicated weight loss or other techniques to help clients lose weight, LipoMax is going to be the best ally that you can have. So first of all, talking a little bit about the technology behind our LipoMax. So first of all, we have the radio frequency. This one is going to help us to stimulate collagen production that will tighten the skin, while at the same time we're targeting fat cells because of the heat production that the radio frequency does. We're going to be producing more elastin fibers to improve the firmness and elasticity of the skin. It's also an excellent option to tighten the loose skin that maybe patients already have after losing some of the fat tissue that they have. And in case we're working on face areas, we can always treat wrinkles and contouring little places like maybe the jawline, or in the case of the body, we can contour the waistline, we can contour the hips, and we can help them contour even the thighs and the buttock. And also we can break down fat cells by targeting areas of the body to contour, and we can also work in cellulite by reducing the tightening of the skin, of the fat in the skin, and we can also break down that tissue to smooth it down and to make it look better. So just like for general information, the way we can actually do those 2 different things is by reaching different temperatures. So if we want to achieve a tightening on the skin, we want to work in between 102 to 113 Fahrenheit. Or if we want to achieve a fat reduction with the LipoMax, we want to work in between 113 Fahrenheit to 122. So depending on the amount of Fahrenheit that we're working on, that's the different responses that we will be getting off the body. So either if it's skin tightening or if it's fat reduction. So also the other technologies that our machine is going to have is the vacuum therapy, which will help us to stimulate the blood circulation on the body. It's going to help us drain the lymphatic system, accelerate the faucet breakdown, and to also reduce the appearance of cellulite. And also, depending on the handpiece that we're using, we're going to have a red light therapy into the big and medium handpieces that are especially designed for the body areas. And we're going to have a blue light therapy for the face to have antibacterial and purifying properties for the face treatments. So our main topic of today is understanding the fat reduction alternatives that we have. So right now in the market, we are working with different methods to help our clients reduce fat tissue, stubborn fat, and maybe if they're already going through a phase of losing a lot of fat, maybe they are not candidates for a surgery, or maybe they don't want to go through a surgery and they want to find different alternatives before getting into that point. So there's going to be a lot of different things that we can do for them. So one of them could be, of course, getting them into a diet, maybe making them to do a little exercise, or we can also use a medicated, we can give them medication like Ozempic, which will be, of course, a prescribed medication for weight loss. We can, of course, if we work with a plastic surgeon or you're a plastic surgeon, you can, of course, do liposuction And of course, there is this other option, which is the LipoMax, which is a non-surgical, non-invasive, and of course, it doesn't have any downtime for the patient. So either if we are working with other alternatives, or we want to get better results after we are already doing something surgical like liposuction, or if we don't want to go all the way into that, we can only work with LipoMax. So it's actually a great ally because you can either use it by itself, the machine, or you can use it to help you give better results with the other things that you're doing already. So how can I mix it? How can I do different things and also implement the LipoMax with my my fat loss treatment? So in this case, as I said, it was a perfect ally to implement with many weight loss techniques. When you are already adjusting a treatment, it will help you break down the fat faster and more efficiently. You will be able to drain toxins, excess fluids, the fat, and sometimes lactic acid if it's needed, faster through the lymphatic system. We're also, in this case, if we're using Ozempic, the first thing that we suggest that you do before is first start the Ozempic to get the body to settle with the new treatment, with the medication. And after between 4 to 6 weeks after you started the Ozempic, then we can start treating the patient with LipoMax to give them faster results of the treatment that they already started with Ozempic, and to get them better results and even faster results by helping them drain as well all the fat that they're burning. The routine, I'm going to give you to the next slide. We're going to talk about how to implement it specifically. But usually most of the treatments that we do with LipoMax is we can do them once or twice a week to get better results for the patient. And of course, we can adjust the treatment according to the needs of our patient. In case they want to do fat reduction, or they want to do skin tightening, or if they want to just do the drainage, in case they already did a liposuction and we want to help them with drainage, we can always make the treatment according to each of our patients. So we don't have always the same treatment for everybody. Everything we can adjust to depend on the needs of them. So how can I mix the LipoMax with the weight loss treatment? In this case, how would I do it with the Ozempic? So for the Ozempic treatment, we know that at the beginning, the patients, first of all, we have to scale them up into the right amount of medication. So first, we're going to start the patient with a 0.25 milligrams of the treatment, and we're going to start seeing how they handle the medication. So usually it will take them between the week 1 to 4, so they can get used to the treatment, just to see that they don't get any other side effects of the Ozempic. Maybe they get a little nauseous, maybe they get some side effects of the treatment. So once we already know that our patient is already with the right amount of the medication that we were going to send him, then after the 4th week of the treatment, we can start implementing the LipoMax to this. So we're going to do once or twice a week the sessions, and we're going to be intensifying the treatment for the patient depending on the response of the skin. Sometimes the skin can get a little too sensitive to the treatment. So this is something that by the moment that we're doing the treatment, we can always implement a little bit more vacuuming power or a little bit more energy into the radio frequency until the patient can start tolerating the right temperature that we want to achieve. As I said before, depending on the temperature, we're going to be able to get either fat reduction or skin tightening. So depending on what I'm doing, I want to reach to those points of temperature, and that's what I'm talking about right now, about getting the patient to adjust to those treatments. After the 8th week that we already finished my package of LipoMax treatments, we will decrease or we can increase the sessions depending on how our patient is developing. Either we still want to get more fat loss, we can continue working with the sessions as tolerated by the patient. And of course, once we finish with the packages of treatments, then we can do a maintenance treatment, and we can do it once or twice a month to just maintain the results that my patient already achieved. It's very important, of course, to get really good results after the treatment, to get the aftercare. So the aftercare, the first thing, it's very important for the patient to drink a lot of water to help them flush the fat faster and not to retain all those liquids longer. So that's important to have between 2 to 3 liters of water daily for them to start drinking. If they can do it before the sessions, they will get better results, and to do it afterwards as well. Always do lymphatic drainage. This is one of the things that we encourage everybody to do right after you finish the LipoMax treatment. We divide the treatment into sections, and the last section of the treatment, we encourage everybody to do a drainage, just specifically to drain, because that will give two things very important. The first one is that the patient will be able to see differences when you do the drainage. And the second thing is that they will have less time to recover from the treatment, and it will shorten the time for the fat loss, because we are helping down the body to do drainage of all the fat that we are been breaking down, to do it faster. Another thing that it's important, we are doing a lymphatic drainage at the clinic or at our place of work, but it's important to tell the patient that it's really good if they at home can do some massages as well. Whenever they take a shower, they can do a little massage, or they can do dry brushing, or if they can, do a little exercise as well to help the body flush faster the fat. And of course, we have some pictures of some of clients that have shared some of their great stories of the patients that they've been already working with different techniques of either dieting and LipoMax, or just a nutritionist and LipoMax. So this is one of our clients' customers. She was a patient that lost 35 pounds, and only with 10 sessions, she got amazing results. This is a result of only dieting and LipoMax. So as you can see, LipoMax is the really good ally to put it next to anything else that you've been doing already, or that you want to start implementing, like dieting, like Ozempic, or other things. This is another male patient, lost 40 pounds, also only 10 sessions. You can see the improvement. We are losing weights in the belly area. We are reducing sizes, even also for the waist. Patients are looking great and they feel great. Even after the first session, they will be able to tell the difference and to see results even after just one session. This is another female patient. We have many different areas on the body we can work with depending on the needs of our patient. Maybe the ladies have a little bit more trouble in the upper part of their backs, because whenever we are using bras, sometimes we have a little fat that accumulates in certain areas that it's very hard to get rid of just by doing exercise or just by dieting. So that's when LipoMax comes in and helps you achieve those very difficult areas. And that's where I can do the machine and put it specifically on those areas that get really hard for the clients to lose. So I can do it in the back, I can do it around the arms, we can do it around the belly. In this case, this female, not only did she lose the fat, but she also achieved a good skin tightening. I don't know if you can see the difference in between the area around the belly button, where she had a lot of loose tissue, and at the bottom pictures, that's the after pictures of the treatment, the skin is tightened back. It looks so much better, so much smoother. And she, of course, lost all that fatty tissue that she has been accumulating. And of course, if we want to know whether our patient is a candidate for a LipoMax treatment or not, we are going to have a patient selection criteria. So who are going to be the perfect clients or the perfect patients for the LipoMax? In this case, every patient that wants to get rid of fat that it's in stubborn areas, like I said, sometimes the belly, sometimes the back, wherever we have stubborn fat areas that they cannot get rid of, or they've been trying hard and they haven't been able to get rid of those, that's going to be your target client. Of course, healthy individuals that don't have any problems, maybe if they have that they already getting close to their target, those are going to be amazing clients. I mean, we're going to give them amazing results, and they will be able to get to the point where they want to be just by using the LipoMax without doing any other thing. If not, of course, patients who have cellulite, who have circumferential, that want a circumferential reduction, if they want to do body shaping or contouring to do a little modeling or definition, of course, if they have localized fat, if they want to just do skin firming because they already lost fat, but now they feel like the skin is a little loose, it's not very firm, and maybe it's not too thick because they've been going up and down in weight, those are going to be amazing patients for this type of treatment. If we want to do drainage, of course, do drainage in the legs, drainage after surgery, those are going to be really good patients for this specific machine. And of course, the post-surgery patients to help them with the recovery time because of all the liquid accumulation after surgeries. Those are going to be like your best clients for the treatment. And of course, as any machine, we are going to have some patients that are not going to be the ideal candidates for these treatments. The first one, if they have severe obesity or certain health conditions, as pregnancy, breastfeeding, if they have pacemakers or electronic implants and they have it in the area next to where we're going to be working, we're not going to be able to treat those patients. If we have an active infection, rashes, or skin conditions close to the area where I'm going to be working, those are not going to be clients that I can work with. Cancer history or vascular conditions in the case that we're working with the legs. Severe varicose veins and blood clotting disorders, also we have to be very, very careful with those. In case you're into the medical field, these are always some stuff that you can, by a clinic, say if it's a candidate or not for the treatment. And of course, what are the clinical benefits of this beautiful machine that we have? The first one is they're going to achieve a fat reduction. They're going to see a visible reduction of localized fat after multiple sessions. We're going to get circumferential reduction, waistline definition. They're going to have an improvement in the skin texture, of course. They're going to get tightening in the skin. They're going to get smoother skin. They're going to be able to lift the skin even, thicken and firmer skin, and cellulite reduction. So these are all changes that we will be able to see through the skin because of the radio frequency that the machine has. We'll be working not only in the fat tissue beneath it, but also in the texture and how the skin overall looks. And of course, this is a non-invasive treatment, which means that it doesn't have any downtime. The patient can come to the clinic, do the treatment, and go back home and do exactly the same as they will do every day. We'll just ask them to do certain things to improve the results. As I said, they have to drink enough water and they have to do maybe a little massage or exercises to improve the results. Of course, as I always say, something that I love about this machine is that even after the first session, the client will be able to see differences. So it's very important to do a before treatment picture and after the first session treatment picture, because you will be able to see a difference in between those two pictures. So you can actually show the client here, this is how you looked before we started, and this is how you looked after the first session. They will be able to see improvements. And of course, after you finish the whole sessions, very important to do one last picture so you can see the before and after the whole treatment that you did. Usually we recommend in between 6 to 10 sessions, depending on what you want to do. If we're working on the face, if we're working with definition of an area, if we want to work with fat loss, we will program the sessions depending on what the results of the patient we want to achieve and the needs of the patient. And of course, if we want to continue seeing this patient, we can do long-term treatments by doing maintenance sessions. And usually we recommend to do once every 3 to 6 weeks. We can do one treatment just to maintain the results. So Good thing about the machine is that this is a patient that will stick to you for a really, really long time because they want to continue having good results. They want to maintain their results. And of course, they are going to love their results. So they're going to stick with you for a very long time. And some of the post-treatment cares that we suggest the clients to always do to get better results. Well, hydration, drink 2 to 3 liters of water daily to get better results by flushing out toxins. Maintain a health diet and exercise routine, which will help also improve the fat loss and the drainage. That will help it as well. Avoid heavy exercise and hot showers right after the treatment, like at least 24 hours after they did the treatment. They have to avoid doing very heavy exercise or the hot showers. If they can, and they should, they can do a little massage treatment in the areas we were working at the shower, or with a little dry brush to help the body stimulate the lymphatic drainage. And avoid sun exposure, of course, directly, because we were working with a high temperature and we don't want to maybe provoke a sunburn on the area that I was working with. And of course, to maximize the treatment outcomes, it's very important for the client to understand that consistency is the key to get amazing results. As long as they understand that they have to come by every time we schedule our appointments, they will get amazing results all the time. To have a good hydration, to take care of the post-treatment information that we give them. And of course, for us to give a good progress monitoring to see the follow-up, if we need to add anything, if we need to change anything, if we have to add more sessions, if we need to maybe change the way we are doing the treatment. Sometimes at the beginning, we want to do only fat reduction, and then maybe after a while, we just want to do skin tightening. So always adapt and adjust the treatment depending to the client's needs. And of course, we're going to be doing a little practice right now where we have a model with us that's going to help us to do a little treatment, so you can see like one of the ways that we can achieve a really good fat reduction into specific areas. And I would like right now, until we are ready to start, if anybody has any questions or wants to maybe share us something, you can please open your mics and we can talk a little until we're ready to start with the practice. And if there's nothing to tell, we can start the practice already.